Lecithin contains phospholipids like phosphatidylcholine. Phospholipids are a type of fat. Your body converts phosphatidylcholine into choline. Choline supports cell structure in the brain, nerves, and organs. Lecithin supplements are often derived from soybeans, sunflower seeds, canola seeds, egg yolks, or other animal products like fish. Agricultural, growing, conditions can determine a plant-derived product's fatty acids and phospholipid amounts. Lecithin is also used in cooking as an emulsifier. It helps stabilize ingredients that don't mix easily, like oil and water. Lecithin is added to topical, on the skin, products and to supplements and medications. It's also been used as a part of placebo, a treatment with no therapeutic value given to participants in clinical trials as part of a control group, products in randomized controlled trials. Unlike drugs, dietary supplements are not regulated in the United States, meaning the Food and Drug Administration, FDA, does not approve them for safety and effectiveness before products are marketed. When possible, choose a supplement tested by a trusted third party, such as U.S. Pharmacopeia, USP, Consumer Lab, or NSF. However, even if supplements are third-party tested, it doesn't mean they are necessarily safe for all or effective in general. Therefore, talking to your healthcare provider about any supplements you plan to take and checking in about potential interactions with other supplements or medications is essential. High cholesterol. Lecithin has been suggested to have anti-inflammatory and protective effects on the cardiovascular system. A small study found 500 milligrams of soy lecithin daily for 2 months reduced total cholesterol and LDL, low-density lipoprotein, cholesterol, considered the bad cholesterol. Larger, well-designed studies are needed to confirm these results. Ulcerative colitis. Low levels of phosphatidylcholine, a chemical found in lecithin, have been found in individuals with ulcerative colitis, a type of inflammatory bowel disease, IBD, affecting the large intestine. Phosphatidylcholine may protect the colon from bad bacteria and inflammation. A meta-analysis, collection of studies, suggested 30% phosphatidylcholine-containing lecithin improved outcomes in people with ulcerative colitis. A study gave participants either 0.8 g, 1.6 g, or 3.2 g of a supplement containing over 94% phosphatidylcholine concentrated soy lecithin for 12 weeks. It suggested improvements in the Simple Clinical Colitis Activity Index, particularly in the group taking the 3.2-gram supplement. Further studies are needed to confirm these results. What are the side effects of lecithin? Lecithin supplements are generally thought to be safe. However, it's possible to have an allergic reaction to lecithin. Ask a healthcare provider before taking lecithin or any other supplement. This is especially important if you are taking medications of any kind or you have a health condition or allergies. Common side effects of lecithin include the following: abdominal discomfort, headache. Precautions. Do keep the following precautions in mind when using lecithin. Severe allergic reaction. Avoid using lecithin if you have a known allergy to it, its ingredients, or products it may be derived from, example, egg, soy, fish, sunflower. Ask your pharmacist or healthcare provider for a complete list of the ingredients if you're unsure. Pregnancy. Lecithin breaks down into choline. Adequate intake of choline during pregnancy is 450 milligrams per day. Breastfeeding. Lecithin breaks down into choline. The adequate intake of choline during breastfeeding is 550 milligrams per day. While some studies have found lecithin may treat or prevent clogged milk ducts, please speak with your obstetrician, your child's pediatrician, or another healthcare provider before using lecithin or other supplements. Children, there is limited research on the safety of lecithin in children. Because of this, children may need to avoid taking it. Please speak with your child's pediatrician or another healthcare provider before using lecithin or other supplements. Dosage: how much lecithin should I take? Always speak with a healthcare provider before taking a supplement to ensure that the supplement and dosage are appropriate for your individual needs. In studies, the following dosages were used for the following conditions. High cholesterol, 500 milligrams of soy lecithin daily for 2 months. Mastitis, 600 milligrams of lecithin daily. Menopause symptoms, 600 to 1,200 milligrams daily. Tardive dyskinesia, 20 to 35 g of lecithin that contained phosphatidylcholine daily for up to 8 weeks. Ulcerative colitis, 0.8 g, 1.6 g, and 3.2 g of a supplement containing over 94% phosphatidylcholine concentrated soy lecithin for 12 weeks. Generally, never take more than the dose suggested on the label. Please consult with your healthcare provider or pharmacist if you have any questions. The watching, interacting, and participation of any kind with anything on this page does not constitute or initiate a doctor-patient relationship with verypudic.com. None of the statements here have been evaluated by the Food and Drug Administration, FDA. The products of verypudic.com are not intended to diagnose, treat, cure, or prevent any disease. The information being provided should only be considered for education and entertainment purposes only. If you feel that anything you see or hear may be of value to you on this page or on any other medium of any kind associated with, showing, or quoting anything relating to verypudic.com in any way at any time, you are encouraged to and agree to consult with a licensed healthcare professional in your area to discuss it. If you feel that you're having a healthcare emergency, seek medical attention immediately. The views expressed here are simply either the views and opinions of verypudic.com, others appearing and are protected under the First Amendment. Verypudic.com promotes evidence-based natural approaches to health, which means integrating her individual scientific and clinical expertise with the best available external clinical evidence from systematic research. By individual clinical expertise, I refer to the proficiency and judgment that individual clinicians acquire through clinical experience and clinical practice. Verypudic.com does not make any representation or warranties with respect to the accuracy, applicability, fitness, or completeness of any multimedia content provided. Verypudic.com does not warrant the performance, effectiveness, or applicability of any sites listed, linked, or referenced to, in, or by any multimedia content. To be clear, the multimedia content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health providers with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have read or seen in any website, video, image, or media of any kind. Verypudic.com hereby disclaims any and all liability to any party for any direct, indirect, implied, punitive, special, incidental, or other consequential damages arising directly or indirectly from any use of the content, which is provided as is, and without warranties.